Wenger exudes passion, professionalism, and generosity, and gives the best patient care and the most articulate presentations. And when you hear her talk in a few minutes, you will see what I mean, because she is one of the most articulate person, even at 93 years old. She is amazing. Next slide, please. Another award that has been bestowed upon her is at Emory University, where she received an endowed professor named after her. One of her patients gave a $2 million endowed professorship, and it is now called the Dr. Nanette Wenger Distinguished Professorship in Women's Heart Health Research. So there will be a very deserving professor at Emory with her name on it. Next. And she has just been named, this is her most recent award, she has been named the 2023 recipient of the Alma de Morani Renaissance Women Award, which is the highest honor bestowed by the Women in Medicine Legacy Foundation. So, without further ado, next slide please. Thank you for your attention, and now you will be hearing from Dr. Nanette Wenger.
Annabelle, let me thank you. It sounded almost like an obituary, but I assure you that I am quite alive. The important feature, though, thinking back, is to realize that Hunter College High School was my launching pad, because I persuaded my parents that I was allowed to take the Long Island Railroad from Long Island into the city every day to attend Hunter College High School. And it was one of the most amazing education I received. People taught me how to learn, taught me how to think, taught me how to write, and taught me how to speak. And that really is the basis for success in this world, just the basics. But as an academic, you give me a podium, and what do I have to do? I have to teach. So what I'm going to do is to spend a little bit of time teaching you what I think everyone, every man, woman, and child, should know about heart disease, including heart disease in women. I think we need the other slide set first.
Oh, the other slide set? Got it.
This is something that I think is a perhaps different approach to learning, but it's one of my approach. And it's a message to everyone to show your heart you care. And these are some guidelines for the prevention of cardiovascular disease, particularly in women, but also in men. Next. I think the important feature is that even today, in 2024, more cardiovascular deaths in women occur from heart disease than from cancer, from respiratory disease, Alzheimer's disease, and eczema combined. So heart disease is our #1 threat. And the frightening feature is that with all the advances that we've made, death rates in young women are increasing. And by young, I'm defining as women 35 to 54. It reversed a trend of the past 4 decades when we were having decreasing deaths. It's largely related to the obesity epidemic in this country, and it's a combination, I think, of obesity, sedentary lifestyle, and much of it reversible behaviors. What one of my colleagues called this was the leading edge of a brewing storm. And we're seeing that COVID has actually accentuated that. The tragedy, of course, is that more black than white women have cardiovascular disease, and it also parallels decreased awareness data among black and Hispanic women. Next. Now, I'm giving you an owner's manual for your heart. You know, we have owner's manuals for our cars, for our dishwashers, but I decided to put together an owner's manual for your heart. And the technical specifications, the parts and features are these. It's a muscular pump. It's a little bit larger than a clenched fist. Our heart weighs less than a pound. It beats over 100,000 times every day. It pumps about 2,000 gallons of blood, nearly 5 quarts of blood every minute. We have about 60,000 miles of arteries and capillaries and veins. And the warranty for US women, if we follow the directions, is on average 81 years for a white woman and 77 years for a black woman. But the important thing is I want you to read the owner's manual carefully for operating instructions on how to take care of your heart. Next. I think the whole idea of this is empowering women with awareness and education. And my message to all of you is that favorable lifestyle changes can lessen cardiovascular risk factors and prevent cardiovascular disease and coronary disease. There's a continuum of risk, and as you see your care providers, they will match the intensity of the intervention to the risk. But the fact is that behavioral changes by women and a reshaping of practice by healthcare providers to address heart disease in women can dramatically lessen the number of women who are disabled and killed by cardiovascular disease. So this is a partnership between women and their healthcare providers. And when you see your healthcare provider, and I'll give you some instructions about that in a few minutes, look at this as a partnership. Next. Now, the main preventive intervention, and the only one I'm going to talk about this evening, is lifestyle intervention. We'll talk about risk factor interventions and drugs perhaps at another time next year. Next. But let's talk about some of the benefits. Why am I making these recommendations? People, both men and women, who quit smoking before age 50 have half the risk of dying over the next 15 years as they would if they continued to smoke. You stop smoking, even at age 50, you decrease your death rate. Smoking cessation improves lung function 20 to 30% within just a few months. And after 1 year of staying away from cigarettes, the risk of coronary disease is reduced by about 50%. And within 5 to 15 years of stopping smoking, no matter how long you've smoked, the risk of stroke is similar to that if you've never smoked. So this is a message, even if you are smoking and have been smoking for a number of years, stop. It will give you benefit. Next. What about walking? In the Nurses' Health Study involving almost 73,000 women aged 40 to 65, brisk walking reduced the risk of heart attack or coronary death by 30 to 40%. We're not talking about marathons, just brisk walking. And women who were sedentary for a long time, but later on began moderate walking, reduced their risk of heart attack and coronary death by 20 to 30%. And even walking at a slower pace is beneficial. It is just the walking. Be active. Next. Now let me give you Wenger's 250-250 rule. And I think it is easy to understand. If you exercise an additional 250 calories a day and eat 250 fewer calories a day, that's 500 calories less every day. And what is that when you multiply it by 7? It's 3,500 fewer calories a week, and that can equate to a pound of weight loss. Very simple. Fewer calories in, more calories out, more weight off. Next. And lifestyle changes work. And let me cite some clinical research. In the diabetes prevention program, and these were overweight adults who had impaired glucose tolerance. That's what it was called then. Today it's called prediabetes. But physical activity for 30 minutes a day and a weight loss of only 5 or 7% of their body weight reduced the risk of getting diabetes by 50%. Very simple. Exercise and weight loss. Next. Now, again, I think Annabelle talked about this. A class 3 intervention means don't use it, they don't work. And menopausal hormone therapy. Previously, everyone said, just give the women their hormones and they're gonna be fine. Well, they weren't fine and they were getting sick. It is not indicated for the prevention of heart disease. And the antioxidant supplements that everybody loves, vitamin C, vitamin E, beta-carotene, they do not work for prevention. I repeat it, they do not work for prevention. And actually, some of the B vitamin supplements can even induce risk. So what we have to do is to do the simple changes that I will outline for you subsequently. Next. And this is available to anyone who wants to get at this. I will share these slide sets with anyone who wants it. But when you visit your provider and you want to know something about your heart health, what you have to do, and these are specific to women, share whether there's a family history of premature disease. If you have a cholesterol, a bad cholesterol, that's over 190, you're at very high risk. Know your numbers. Check whether you have kidney disease or metabolic syndrome, because that increases your risk and your doctor can work with that. The hypertensive disorders of pregnancy, such as preeclampsia or gestational diabetes. Share your pregnancy history with your healthcare provider, because if you have complications of pregnancy, you're at higher risk. And for those of you who know about electronic medical records, often the OB record is not combined with the general record. So if you have your OB records, bring them to your primary care provider. Inflammatory diseases like lupus and rheumatoid arthritis, those patients die not of their lupus or rheumatoid arthritis, they die of heart disease. So you need more prevention. If your ethnicity, such as South Asian or Hispanic or African American, that puts you at increased risk. That means you need more precise risk factor control. Another blood fat, triglycerides if it's high, a blood test, CRP if it's high, Lp(a) if it's high. If those are high, you may want to do more precise risk factor control. And then an ankle brachial index, which measures the blood flow to your leg. If that's abnormal, more risk factor control. So here I'm giving you an agenda that might initiate a discussion with your care provider to say, am I at risk, and what do I have to do initially about lifestyle? Okay, let's close this one out and go on to the second set that I have borrowed very intensively from the American Heart Association, because it was my privilege to work with the Heart Association putting them together. And this is called Life's Essential 8. 8 is really simple to do this way. And let's see what are Life's Essential 8. These are my disclosures. They haven't changed since the last presentation. Next. And Life's Essential 8, we'll be talking about sleep, we'll be talking about diet, we'll be talking about activity, we'll be talking about blood glucose, we'll be talking about weight, we'll be talking about lipids, and we'll be talking about blood pressure. 8 things that are fairly simple. Next. And the new one, it used to be Life Simple 7. Do you remember hearing about that for years? Now sleep is included. And believe it or not, we have found that sleep is a very important part of general health in addition to sleep health. So I'll be spending some time with that. Next. Now, there's a series of things that you can do in terms of how to eat better. We're not talking about diet. We're talking about creating a healthy eating pattern that is based on fruits and vegetables and whole grains, that restricts processed food, that restricts the amount of high-fat food that you eat. And the first message is to read the nutrition labels. Now, years ago, the nutrition labels were so tiny that you need a magnifying glass to see what's there. Now, the new regulations have made them larger, but you may still be, if there are that many processed foods, there's so many ingredients in there, you may need it. If there are too many ingredients in it, it's a processed food, stay away. That's the message. And then there are a number of tips for success. Watch the calories. Calories do count. And cook at home. First place is physical activity, so that will help. But when you cook at home, you know what you're eating. When you eat out, particularly when you eat at fast food establishments, all you're doing is loading your body with calories and sugar and fat and salt. Look for the heart check. The Heart Association puts its check on certain foods as being heart healthy. And then if you're in need of inspiration, go to the Heart Association website and you'll get inspiration about how to eat better. This is a very important part of your health. Next. How to be more active. 150 minutes of moderate intensity activity, or if you're really eager to run or swim, 75 minutes. And be strong, doing resistance exercise. That's important in addition to the aerobic exercise. And add intensity. If you're walking very slowly, the next time pick up the pace. If you're walking for 10 or 15 minutes at a time, stretch it to 20. And sit less. We've all seen advertised the standing desk, the standing workstation. But one of the things I say is don't pick up the phone or text if you want to talk to one of your colleagues. Walk down the hall. That's physical activity. And we don't do that enough. Next. How to quit tobacco is first to educate yourself about the risk of tobacco. It's not only smoking, it's vaping, it's hookah, and what most people don't appreciate is the risk of secondhand smoke. So if there is someone in your household smoking, see what can be done either to have them stop smoking or to smoke outside the house. And make a plan to quit. Set a date, choose how you're going to do it, decide whether you're going to use any of the assistances like patches or gum or what have you. Prepare for what you're going to do, and then quit. And the fact is that you have to deal with the urges, you have to get active. Notice that we're repeating this for all of the issues about get active, handling stress, getting support, and most importantly, stick with it. Next. Now, how to get healthy sleep. I don't think any of you have been taught anything about sleep, other than your parents telling you it's bedtime. But the question is how sleep affects your health. It affects every one of the body systems, and the benefits of sleep are healing and strength, and everything gets improved, brain function improves, and less risk of many, many diseases. And the tips for success are really simple. Get all of your devices as far away from your sleep area as possible. Stop the habits of scrolling through your devices. Get to a place where it is quiet, where there is very little light. We're always taught to set alarms. Why don't you set an alarm for going to sleep in addition to an alarm for waking up? And very, very important, don't binge on any of your devices. The devices have been the major impediments to sleep, and this is important for the teenagers in your life as well, because the extension of most teenagers' arm is their phone. Next. Now, how to manage weight. Keep track. And there really is use for a scale. You have to reduce the calories in and increase the calories out, and we've talked about that. And what we have to do is to learn what is a BMI, body mass index. So a relationship of the weight to the height. And an ideal BMI for everyone is about 25. And the tips for success are to control portions. What I tell my patients in clinic is get rid of the dinner plates in your cupboard. Use a luncheon plate. Because if you have a smaller plate, you'll have smaller portions, and you'll begin to learn portion control. Get active. Remember, we're talking about activity again. Eat smart, meaning you know the calories of the food. If you're really hungry, start with a big salad and start with something low calorie. If you're not really hungry, that's the time to eat some of the calorie-dense foods that you really crave. And then get help. You often can't do it alone. You may need a nutritionist. You may need some kind of a support group. Next. How to control cholesterol. And you have to understand cholesterol. Only part of the cholesterol level comes from what we eat. Most of the cholesterol is made in the liver. And as I tell my patients, you don't have control over that. Your body is setting that. So if you say, I'm going to try to control my cholesterol, if it's slightly elevated, you can do it with diet. But if not, it's going to require a medication. HDL, high density lipoprotein, is the good cholesterol. LDL is the bad cholesterol. The important thing is to track the levels. Your healthcare provider will do it, but you need to keep records for yourself to see how you're doing. And again, eating smart, have we said that before? Move more, have we said that before? Know all of the fats, to know the saturated fat and unsaturated fat, to stay away from polyunsaturated fat, and they live in processed foods. They live in fat foods. No nicotine, that will really help. So the risk factors really interchange one among the other. And then take medication if it's needed. And the decision for medication is one that you'll make with your healthcare provider based on your numbers and the risk. Because if you're at higher risk, you'll probably be recommended medication earlier on. If you're at lower risk, well, maybe we can wait a little bit. But it really is cholesterol over a lifetime that determines your risk. People talk about 10-year risk. Don't most of us think about living for more than 10 years? So let's not talk about 10-year risk. Let's talk about lifetime risk. Next, how to manage blood sugar. And you have to understand blood glucose. And the sugar in your body is influenced or controlled by the insulin that your body makes, that your pancreas makes. So you have to be able to track the levels. And we have numbers that are what we now call prediabetes and diabetes. And again, depending on the numbers, that will determine the need for medication or no medication. Some of this can be diet controlled. And the tips for success, have we heard these before? Eat smart, move more, manage weight, and no nicotine. You see, they become so repetitive that this is why I say that lifestyle is so important. Next, how to manage blood pressure. You know, when I was in medical school, nobody was very smart about blood pressure. And the blood pressure, the upper number, the top number, the systolic, was supposed to be 120 plus your age. And what that was doing was just measuring the prevalence of disease in the population. And now we know that whether you are 20 or 90, the ideal blood pressure level is 120 over 80. The ideal blood pressure is 120 over 80, and that should not increase with age. Track the levels, again, and the tips for success, have we heard this before? Eat smart. So many of us are salt sensitive, and I tell my patients that decreasing the amount of salt is almost equivalent to taking another blood pressure medication. And then the power of TV. And my patients will come in and tell me, Dr. Willier, you'll be so proud of me. I've stopped eating salt. I'm eating Himalayan salt, or I'm eating sea salt, or I'm eating kosher salt. The power of marketing, salt is salt. Some of the others just cost more, but salt is salt. Eat smart, move more, manage weight, no nicotine, and sleep well. Healthy sleep promotes good blood pressure. Next. And these, ladies and gentlemen, are life's essential 8, and this is the way to ensure your heart health, and I thank you very much for your attention. Let me introduce to you Dr. Stacy Rosen, who is a leading cardiologist in the New York area, and she's here as a representative of our partner for this, the American Heart Association.
Thank you. So unlike Dr. Wenger, my Long Island mother would not let me come in and train to Hunter High School, though she is a Hunter College graduate from 1960. And she still jokes that her parents considered Brooklyn to Lexington to be an out-of-town college. So my thinking of the Long Island Railroad and